All right, good morning, everyone, and thank you for being here at Hummingbird Place. My name is London Breed. I'm mayor of the city and county of San Francisco, and I am excited today. I'm excited because we know today's announcement is bringing us one step closer to our goal to make sure that we provide options for people that we know are suffering on our streets. Some of you know that I made an announcement a couple of weeks ago to add an additional shelter beds, 1,000 shelter beds here in San Francisco by 2020, and we are working hard every single day to accomplish that goal. But we know that just building housing, providing shelters is just not sufficient for some people who need a little bit more support. It's just not enough. And many on our streets, unfortunately, are suffering from mental illness and substance abuse disorder. Today, we are at Hummingbird Place, which helps the most vulnerable residents break out of the cycle between the streets and the jails and hospitalization. Here, medical professionals provide personalized care and innovative services for behavioral health and substance abuse clients to help reach their goals. Hummingbird Place is tailored for individuals experiencing mental illness and addiction. By providing these beds, we can leave no doubt that people have an option to get off the streets every night. And we can do more. And that's why today, part of the announcement is that we are doubling the number of beds here at Hummingbird to 14. We are committed to addressing the root causes of homelessness and providing access to mental health recovery. And we also know that more beds at Hummingbird just aren't enough. Initially, the Department of Public Health had a plan to add another 40 beds here at General by 2021. And that's too long to wait. And so I basically decided that we need to move faster and we need more beds. So I've given a directive to the Department of Public Health that we not only need to make sure that those beds are added by next year, but we need more than just the 40 beds. And ultimately, by next year, we will have 70 to 90 new mental health stabilization beds in the city and county of San Francisco, which is absolutely amazing. These mental health stabilization beds are just a piece of the puzzle. There's so much more work that needs to be done. And today at the Board of Supervisors meeting, Supervisor Rafael Mandelman and I will be introducing legislation to implement State Senator Scott Wiener's bill, SB 1045. Many of you have heard a lot about SB 1045, and this bill, which was championed by Senator Scott Wiener and supported by Assemblymember David Chu and signed by Governor Jerry Brown, requires us here locally to opt into a new conservatorship program to help those who are suffering from mental illness and substance abuse disorder, those who sadly are dying on our streets and, as I said before, cycling in and out of our jails and our hospitals. I want to thank Senator Wiener for his leadership and Supervisor Mandelman for his partnership. I also want to thank the city staff and all of those, including those in the city attorney's office, who have been working months before the bill was ever signed so that we could be ready for this day to move as quickly as possible. And that is why the combination of this legislation and these new beds are going to help us get to a better place for those people that we know need help. Conservatorships, we know, are a challenge, and we are going to continue to engage all stakeholders on finding solutions for the purposes of helping this population. But we know we can do more, and we can't wait for new solutions. We have an opportunity today, right now, to increase our capacity and move this legislation forward so that you see a difference and those people who we will help will feel a difference. And we're not going to be able to make it just go away. We haven't been able to so far. It's time to try new, innovative ideas for the purposes of addressing what we know will continue to be a challenge in San Francisco unless we're prepared to make the hard decisions, the right investments to move our city forward. I'm committed, and all of the folks who are standing here with me today are committed to addressing this challenge. And with that, I'd like to take this opportunity to introduce someone who understands this issue and who is working hard every single day in Sacramento to provide the changes to state law that will help San Francisco move forward in addressing our homeless crisis, and that is State Senator Scott Wiener.
Thank you, Mayor Breed, and Madam Mayor, I just want to say thank you to you for your extraordinary leadership in coming into office and immediately pressing forward with innovative new approaches to addressing the homeless crisis and the crises of mental health and addiction that we see, or mental illness and addiction that we see playing out on our streets every day. I think the mayor recognizes that the status quo isn't working. She recognizes that money is important, but money isn't the only thing that we need, policy changes. So in addition to expanding the shelter bed system and our mental health bed system, which the mayor is doing, also advocating for conservatorships, advocating for safe injection sites, for all of the pieces that we need to come together to really improve the tragedy that plays out on San Francisco streets every day. So Madam Mayor, I want to just say thank you as a resident of San Francisco for your leadership. And I also just want to express my profound gratitude to the mayor and to my successor on the Board of Supervisors, Supervisor Rafael Mandelman, for really taking the bull by the horns in terms of helping us pass Senate Bill 1045. The mayor and Supervisor Mandelman personally came up to Sacramento to advocate for this bill, but then moving forward immediately to craft and to pass local implementing legislation so that the conservatorship bill, so that SB 1045 can be the law in San Francisco. It is not progressive, it's not humane, it's not compassionate to sit by and watch while people unravel and ultimately die on our streets. We know that conservatorship is a significant thing. It's not to be taken lightly. It is temporarily removing someone's civil liberties and their ability to make decisions for themselves. And that is significant, and we do take it very seriously. But allowing someone to die on the streets is a lot more extreme than temporarily having the city make housing and health decisions for someone so that they can get healthy and get their lives back. We have a situation now where people are unable to make decisions for themselves. There are homeless people, plenty of homeless people in this city who, if you offer them housing, if you offer them services, you're going to be able to get them help and get people on track. But there is a small segment of our chronic homeless population who are not able to make those decisions, and they are dying, and we need to save their lives. And as I have said, and at times debating people who are a little more skeptical of conservatorships, we already have a very robust conservatorship program in San Francisco. It's called jail. And our jails should not be our primary mental health providers. Los Angeles County Jail should not be the largest mental health provider in the entire United States of America. People should be able to get mental health and drug addiction treatment without having to be arrested and interacting with the police and going to jail. And yet that is the system that we have set up right now, where these people are just cycling through jail, they're cycling through interactions with the police, and we need to give an alternative in this conservatorship program for this targeted, narrow population will help them to survive and ultimately thrive. So now it's my pleasure to turn it over to my colleague and my own Assembly member, Assemblyman David Chu, who was a vocal supporter of this legislation.
Thank you, Senator. Let me first start by thanking all of the men and women who make up the leadership of our public health system here in San Francisco. Whether you work for city government or you work for a nonprofit, you are reflecting the very best of who we are as citizens in the city of St. Francis in taking care of those who desperately need help. And I want to salute my elected colleagues who are here. This is the team of elected officials who went to Sacramento to say we need a change in state law to help address the suffering on our streets, the fact that people are dying on our streets. The status quo is not acceptable. I want to salute Mayor Breed for her dogged advocacy, for bringing a moral urgency to these issues in her first 100 days as mayor, and also for supporting and moving forward opening up new beds for a population in desperate need of them. I want to salute Senator Scott Wiener, who has been a dogged advocate for significant change, but particularly with this conservatorship law. There were a lot of questions and, frankly, some controversy about what this was about, but we were able to answer the questions and help people understand that this is not a gigantic step forward. This is an important step forward if you care and have compassion for those who are suffering. And Supervisor Rafael Mandelman, who will be introducing an ordinance this afternoon, I want to thank you for your leadership. You have a personal experience that helps elucidate for so many people why this is important. There is no one single solution to addressing the challenges we see on the streets every day around mental illness and substance abuse, homelessness, and our housing crisis. But we need all of the above solutions. We need to keep pushing on tested solutions that are innovative. We cannot be afraid of the status quo of making sure that we're moving forward new things in the city of San Francisco. That is what we are about. We also need to make sure we're breaking down the silos between what we do when it comes to helping our most vulnerable who are chronically homeless, those who are mentally ill. We have to make sure that our housing and healthcare communities are speaking to each other, and as a chair of the Assembly Housing Committee, that has been a top priority of mine. And so with that, I look forward to working with the collective San Francisco team to making sure that these are laws that are put into place, that these are beds that are put to use, so that hopefully someday people can point to our city, people can point to our state and say, you know, it was in San Francisco that we were able to turn around this crisis. And with that, it's my honor to bring up one of the newest members of the San Francisco Board of Supervisors, Rafael Mandelman.
Thank you, Assemblyman Chu. I notice we've been joined by my junior colleague, Valley Brown from District 5, who by about 5 minutes, I think, is my junior colleague. But we are so lucky in San Francisco to have such an amazing team in Sacramento, and I'm reminded of that on almost a daily basis. But, you know, Assemblyman Chu, for your dogged advocacy for affordable housing in California and your recognition of the need, the tremendous need that we have, and Senator Wiener for everything, like so many bills. But particularly, you know, SB 1045 has been important to me. And then I want to thank our mayor for your clear commitment to getting mentally ill and drug-addicted folks off the streets and into the care they need, your commitment to expanding our shelter bed capacity significantly, and to building out amazing institutions like Hummingbird. These beds are incredibly needed. I recently had the opportunity to tour Hummingbird, and I am a big fan. We need many, many more Hummingbirds, and I see this as a good down payment on that. I'm pleased to be joining the mayor today as we introduce legislation that will authorize San Francisco to implement SB 1045. I see this as the start of a conversation for our city, and I look forward to collaborating in the weeks ahead with stakeholders, advocates, and key city departments to make this program as effective and successful as possible. By introducing the legislation today, we're taking a necessary first step to get that conversation started. As I walk around my district and just about every neighborhood in San Francisco, it is painfully clear that we cannot wait a day longer. We can't continue to allow our jails to serve as open-air mental we cannot allow our neighborhoods to serve as open-air mental institutions, our jails as shelters, and our hospitals as a temporary way station between the two. It's not humane, and it's not the response of a civilized government in one of the wealthiest cities in the world. So SB 1045 and its local implementation is not a cure-all, but it offers one tool to help people suffering from severe mental illness and addiction who are otherwise left to fend for themselves on the streets. And its implementation offers us the opportunity to take a hard look at our responses to those challenges, to build on what's working, and to fix what's broken. Much of the conversation over the coming weeks and months is going to be centered, I think, on adequately resourcing this program and others affecting this population. There will always be a need to expand services and care, and as we implement SB 1045, we must ensure we don't take resources away from other programs. I know everyone up here is supportive of the need and recognizes the need to build out our funding for responses to homelessness. And I look forward to working with my colleagues on the board and with the mayor to ensure that those resources are effectively deployed. So I want to, again, thank the mayor and Senator Wiener and everyone up here for your commitment to addressing these challenges, and I look forward to partnering with all of you to implement effective solutions. I said that I'd had the opportunity to tour Hummingbird a little while back, and I also had the opportunity to tour this amazing facility, and I just want us to recognize what an amazing institution General is and how many people it serves and how much good it does. One of the people doing extraordinary good work in psychiatric emergency services is Dr. Bland from San Francisco General Hospital, who is up next.
Thank you. Thank you so much for having me. Hi, I'm Anton Nagusa Bland, and for the benefit of the press, my last name is spelled Nigusse space Bland. I'm the medical director for psychiatric emergency services, also known as PES, at Zuckerberg San Francisco General Hospital. The PES is the only service of its kind in San Francisco. PES is the only place where a person with a mental health crisis can go and be seen by a physician, a psychiatrist, 24 hours a day, 7 days a week. As you can imagine, the need for mental health services in San Francisco is great. Our dedicated team of nurses, psychiatrists, and therapists conduct over 7,000 emergency psychiatric assessments each year. Our patients are facing complex challenges, including homelessness and drug addiction. 6 out of 10 individuals that come to PES are experiencing homelessness. And if a person is homeless, they have on average 3 or more visits to PES each year than someone who is not homeless. Successfully addressing challenges like these requires the collaboration and innovation of our medical community, our health department, our civic leaders, as well as our community partners. Before Hummingbird Navigation Place Center, an individual struggling with homelessness received referrals from PES at discharge with the hope that they would then travel to a distant part of the city to begin a treatment program for their recovery. What we know is that recovery is very difficult to achieve on your own. With Hummingbird Navigation Center being on the campus at San Francisco General, patients now have a low barrier, readily accessible option to begin to take a break from the streets, the stresses of homelessness, and begin to engage in wellness and recovery. Hummingbird Place Navigation Center fills an important need in the continuum of care for individuals who are experiencing homelessness and struggling with mental illness and substance use. In the first year of Hummingbird Navigation Center's operation, PES generated over 30% of the referrals to the Navigation Center. The unique peer approach support that takes place at Hummingbird helps extend the reach of crisis stabilization services beyond PES into a home-like environment where our patients experience compassion, respect, and mutual empowerment on their path to recovery. With the additional 14 beds becoming available at Hummingbird and the additional subacute treatment beds at San Francisco General to be developed, our healthcare system's options will increase, and we will be better able to ease the transition from the acute emergency care settings back into the community. Hummingbird Place has been an important partner for PES, enabling us to provide a better care experience for our patients when they leave the hospital and supporting them in breaking the cycle of this crisis. Thank you for your attention, and with that, I'll introduce Mr. Simon Pang, the lead team member for the San Francisco Fire Department's EMS 6.
Thank you, Mayor Breed, for this invitation to speak. My name is Simon Pang, and I am a captain in the San Francisco Fire Department. I work on a unit that responds to frequent 911 users, shepherding people towards shelter, detox, treatment, mental health care, and supportive housing. Of those that are dependent on 911 for their daily survival, a small number, in my estimate, less than 10 individuals have such severe substance use disorder and mental disorganization that they cannot perform routine acts of daily living. These few individuals don't have the agency to get food at St. Anthony's. Some lack the strength to dress themselves. Some have life-threatening infections that will not heal. Some are ineligible for shelter, for not only are they chronically incontinent, but they refuse to participate in self-hygiene. I want to be clear. These individuals don't own phones or a tent. They aren't calling 911 for themselves. The compassionate citizens of San Francisco call 911 for someone unconscious on the street or for the person that has been sitting in their own excrement for the last 8 hours. What does this small group of individuals have in common? Severe substance use disorder, mental illness that has been exacerbated by substance use, and homelessness, which in my view is driven by the addiction disorder. These few individuals will use until they are incapacitated, stumble out of an emergency room as soon as they can walk, or are rolled out of an ER in a wheelchair, and use some more. It is a vicious circle of misery and illness of which they have no insight or agency to stop. One such person activated 911 over 200 times last year. Because it is deemed that their psychosis and disability are rooted in substance use, current conservatorship laws don't apply. More resources are not the answer to the misery of these few. The city of San Francisco has offered these few, at no cost to the individual, shelter, navigation center placement, an apartment with supportive care, food, counseling, therapy, drug treatment, but it is continuously refused. My team, EMS 6, met with one individual 53 times last year and offered 53 times to assist him with every aspect of getting housing. But we never got him through the DMV door to get a copy of his ID, step one in the application process. That man died this year, found hypothermic by paramedics. SB 1045 is not a magic wand. It is a tool that can provide temporary respite so that, free of substances, a person's mind may clear, their body heal, and to give them the possibility to discover the desire for a better life. Thank you.
Thank you. That concludes our press conference for today, and thank you all so much for being here.